I have recommended this treatment option for you based upon the fact that you have failed other erectile dysfunction treatment options. Additionally, I think this would be a very good option for you in order to get you back to a good, happy, healthy sexual function. The day of your penile prosthesis procedure and the night before, we will have you actually do a pre-op scrub for your skin. Once that is done, you will show up without having eaten or drank anything since midnight or whatever the anesthesiologist has suggested for you. You will then show up to the day of the procedure at the hospital, and at that point in time you will be checked in. Once you have met with the anesthesiologist and a plan has been made for your anesthesia, you will meet with me, and then you will shortly thereafter be taken back to the operating room. Once you have been placed under anesthesia, we will begin the procedure where we will place the penile prosthesis into the penis, as well as the pump in the scrotum in the reservoir next to the bladder or in an ectopic position. Once this is completed, you will have a catheter placed and a drain placed, and you will have a dressing. You will have what we call fluffs and a scrotal support, and from there you will be awakened and transferred to the post-anesthesia care area. You will spend one night in the hospital. The catheter and the drain will be removed. You will ice overnight, and we will re-wrap your penis in the morning after evaluating the incision. Once everything is satisfactory, we will discharge you home. The typical hospital stay for a penile prosthesis is simply overnight. This is not something that I like to keep anyone longer than that. Generally speaking, it can be done as an outpatient if there is need for that, but I feel it is best served for patients to be doted on overnight in the hospital and have an opportunity to ask any questions the next day before they are discharged home. The clearances that will be used for you to have the surgery will be acquired from your general practitioner. If you have a cardiologist, we may ask you also to visit with that individual. The same would be for a pulmonologist if you have significant pulmonary disease. Most people simply need a pre-op clearance from their general practitioner, and that would suffice. Like all anesthesia procedures, you will need a driver to bring you to and from the hospital. This is not something that you can safely do on your own, so you will definitely need help for transportation. Prior to the penile prosthesis, you do have several options how to manage things. If it has been some time since you've had a satisfactory erection, I would recommend that you spend some time with the vacuum erection device for approximately a month. We do recommend that you use the vacuum erection device with the penis fully erect for approximately 10 minutes per day. At that point in time, you may gain further length on your penis when we insert the penile prosthesis. If you have had reasonable erections up until the point that we are implanting the device, you may skip this step. When we do have you follow up for the penile prosthesis the day before and the morning of, I would have you utilize an antibiotic scrub. Following the penile prosthesis, we do supply antibiotics as well to help prevent infection. Otherwise, we would have you be NPO, meaning nothing to eat or drink after midnight prior to the procedure. When a person is preparing for the penile prosthesis surgery, I do ask that you follow the directions that the anesthesiology department has at the hospital with which we are placing the device. They generally will tell you which particular medications to continue and which medications to stop. As far as I am concerned, I generally would prefer you not to be taking any blood thinners, but would ask that you clear this through your primary care doctor, or if you have a cardiologist, that person. There are restrictions prior to you having surgery regarding what you can eat and drink. Oftentimes, we will ask that you do not eat or drink after midnight the day prior to your procedure, so that the morning of your procedure you come without having ate or drank anything. This sometimes varies based upon the timing of your procedure, and follow directions very specifically as given to you. I would ask the day of surgery that you pack a typical overnight bag with some loose-fitting clothing for a change of clothing, perhaps whatever toiletries you would like to have. We will not allow you to shower at the hospital, so you do not need anything like that, but a toothbrush, toothpaste, etc. that you prefer would be reasonable, as well as the loose-fitting clothing. We ask that you do not shave prior to your procedure, as if you get any nicks, that can contribute to infection. We will shave you on the day of the procedure, so this is not something you need to be concerned with. The day of surgery, you will show up, be checked in, and visit with our nurses. After that, you will visit with the anesthesia staff. Once a plan has been made for your anesthesia, you will then meet with me. Prior to be taking back, all your questions will be answered. When you go to the operating room, you will then be induced with an anesthetic based upon that plan. We will then place the penile prosthesis, and you will wake up with a dressing, a catheter, and a drain. You will awaken in the post-anesthesia care unit and then be taken to a hospital room where you will recover overnight. In the morning, the drain and dressing and catheter will be removed. When that comes out, we will rewrap your penis, and if it is inflated, we'll deflate it. We will then let you go home once you are able to urinate. If a person is nervous about the upcoming penile prosthesis surgery, I do want to remind you that this is going to give you excellent sexual health afterwards. Keeping a goal in mind as to why you are doing this will be very helpful. Otherwise, understand that we are a very competent staff that does this quite frequently, and you will be in excellent hands. Prior to the surgery, if you have any questions or concerns, you are welcome to address them with my nursing staff at the office. If they cannot answer your questions, I would be very happy to return a phone call or have another visit with you. We want you to have all of your questions answered, as I do understand this is a very significant step in your health.